All right, everybody. I think everybody's coming back. So I already introduced myself for those of you joining us. My name is Maria Santos. I am an M4 here at the University of Michigan. I go by she, her, hers pronouns. I am an able-bodied cisgender female, first-generation immigrant, born in Bogota, Colombia, very proud Latina, raised in Atlanta, Georgia, and I'm going into family medicine this summer. I am so excited to introduce this next speaker, who I'm so proud to call a mentor, a friend, a dance partner, if you will. And I'll just give a very brief bio. So Dr. Alastair Martin is a practicing emergency physician and former chief resident at the Massachusetts General Hospital. He is a dual degree graduate in Harvard Kennedy School and Harvard Medical School joint degree program, and served as a former health policy aide to Governor Peter Shumlin of Vermont and Congressman Raul Ruiz of California, and blends state and federal policy knowledge with hands-on patient experience. He now serves as faculty at Harvard Medical School in the Center of Social Justice and Health Equity, working at the intersection of public policy and medicine. He is the founder and executive director of VOTR and the national organizing director for Get Wavered. And like I said, I can't say enough good things about him. And without further ado, I'll let him speak.
Maria, very good to see you, and so glad to be here. Thank you for inviting me. My name is Alister. I use he, him, his. I'm an able-bodied cisgendered man, and I'm an African-American man. I take care of patients at Mass General Hospital as an ER physician. And today we're going to be talking about the intersection between voting and health, and how if we really want to change things in this country, we've got to help people vote, and we've got to do it in the settings where they often are sitting, waiting for hours, like, emergency rooms, community health centers, primary care clinics, where we have effective, trusted messengers like healthcare providers to invite them into the process of voting. So first, I'm going to share my screen here. All right, we're going to get right into it. They told me to make this a little interactive, so I gotta meet the demand here. And we're going to start with a little pop quiz. Pop quiz. You're going to see a couple of questions here on the screen. And what I want you to do is I want you to look at the questions real hard, and I want you to try your best to come up with the answer for each one of the questions. And in the chat, I'm going to give you a minute and a half, okay? In the chat, I want you to put how many of these questions you think you got right, okay? Be honest. Question number one, what is a Republican form of government? Who knows the answer to that? Question number two, what are the names of the three branches of the United States government? Number three, in what state senatorial district do you live? You cannot use Google, by the way. It's a pop quiz. It's not an open book test. You cannot use Google. I don't want to see anybody's phones. I don't want to see any other tabs on Chrome. You got to answer these questions right off the top of your head. Question number four, what is the name of the state judicial court in which you live? And what are the names of the county or counties in such district? So write in the chat, please, how many of these questions you think you got? I feel like I could get one of these right. So I'm just going to say that just to sort of figure out, just to let you all feel sort of normal about where you might be coming in. So let's look at the chat. Let's see what we got. See, if I see a bunch of fours in here, I'm going to have some questions. Let me see. I see 2.5. I see 1 out of 4. I see a lot of ones. Couple twos. Sarita, I like that a lot. Oh no, the top of my head is broken. LOL. Excellent. Okay, so on average, I mean, I'm not a statistician, but I would say on average, the average is about 1 to 1.5 from what I'm seeing. Let's keep the answers coming in. We're going to get a little harder now, a little bit harder, just a little bit. Okay, a little harder. These 4 questions. If a person is charged with treason, denies his guilt, how many persons must testify against him before he can be convicted? Who knows the answer to that? Question number 2, at what time of day on January 20th, each 4 years, does the term of the President of the United States, and again, I want to see no Google, nobody looking at this on your computer. Question 3, if the President does not wish to sign a bill, how many days is he allowed in which to return it to Congress for reconsideration? Question 4, if a bill is passed by Congress and the President refuses to sign it and does not send it back to Congress in session within the specified period of time, is the bill defeated or does it become a law? Short answers, please. So I want to look again. I'm going to check the chat out and see what we got in terms of how many people, how many questions you think you could answer correctly here. Let me take a look. 0. I see a lot of 1s. Which one would you guys, are you kidding me? You would get 1 of these right? Unreal. I would get 0 of these questions right, but okay. I see a lot of 0s and I see a lot of 1s. So I'm going to say that the average here is about a 0.5. What did I just make you guys do? We've been joking. We've been having fun. In order for you to have voted in the state of Georgia in 1965, you would have had to answer these questions correctly. These are the 4 easiest questions out of 30. These are the 4 easiest questions out of 30. You need a 100%, by the way. These are the questions from Alabama. These are the 4 easiest questions out of 25. Again, 100%. If you're a person of color in certain parts of this country, within the lifespan of our parents, and you saw these questions, it's possible that you saw these questions because you were trying to vote in this country. This is a literacy test. And throughout the South, and by the way, also throughout some parts of the North as well, and the Midwest, African Americans and people of color throughout this country were systematically obstructed from voting. Why? Because voting is how you change things. You know, I have a lot of conversations with my patients about voting, you know, because of this whole vote ER thing. And often I hear patients say, you know, well, what does it matter to me? Like, I don't like voting ain't, you know, it's not that serious. Well, if it's not that serious, why are they trying so hard for you to not vote? This is the state, and I want to sort of make sure that the history is clear here. We got to start with the history to understand why it's so important to make sure that we vote and to make sure that our patients do it too. Let me give you just 1 more. This is the state of Louisiana. I saved the best for last. First of all, just check this proviso out at the top. Do what you are told to do in each statement. Nothing more, nothing less. Be careful, as 1 wrong answer denotes failure of the test. You have 10 minutes. Let me draw your attention to this one. In the space below, draw 3 circles, 1 inside, engulfed by the other. What? What about this one? Draw a line from circle 2 to circle 5 that will pass below circle 2 and above circle 4. But like, is it a line? If it's like, there's so many questions. The bottom line is these were set up for you to fail. Now, a lot has happened since then. Thankfully, we had the 1963 and 1965 Voting Rights Act, which did a lot to peel back and to protect the ability for people of color in this country to vote. But let's just look at the most recent history. In 2013, we had a really, really important court case. And Shelby versus Holder basically gutted the Civil Rights Act. We're not at square zero again, but we're like at square 0.5, okay? The things that you just saw, now because the Civil Rights Act has been gutted, are on the table. And if you don't think that, the folks that don't want people, like me, people of color on this line to vote, well, guess what? It's already happening right under your nose. This is from the Brennan Center. 2021 restrictive bills. Basically, each one of these states is where there is a law that is either being proposed or has been proposed to restrict voting access. So the fight continues, and it's incredibly important for us to stay vigilant and understand and protect from backslide sort of all the gains that we've made. I'll tell you one other story. This is a legend right here, Frances Fox Piven. This woman is 89 years old. Does anybody know what Frances Fox Piven did? If so, put it in the chat. I'd be so curious. While you're doing that, let me tell you, Frances Fox Piven started the Human Serve campaign, okay? This was a campaign that she started back in 1983. She's a social worker. She started this with a very small team of social workers, and really this turned into an incredible movement. In 1983, the Human Serve campaign aimed to increase voter registration among clients at public and nonpartisan and nonprofit agencies. She first started by trying to persuade governors and mayors to implement voter registration basically by fiat, sort of by decree in state agencies and city agencies. She then went to directors of voluntary and social agencies, places like WIC, welfare, unemployment, and tried to persuade them to make voter registration a function of, getting your WIC resources, a function of getting welfare, a function of getting unemployment. And she went one by one to these agencies and these services and these governors and these mayors until she hit it big. In 1993, she was able to work with then first-term President Bill Clinton to pass this law, the National Voter Registration Act of 1993. And what this law set out to do was to make it mandatory in places like DMVs to do voter registration. So if you're at the DMV, it mandated them to offer you and invite citizens voter registration. It also encouraged hospitals to promote voter registration, but it didn't make it mandatory. And so I was talking to her. I actually had a conversation with her just a couple weeks ago, and I was like, "What's up?" So, Frances, first of all, this is, it's an honor for me to be talking to you. I feel like in many ways, the work that I'm doing sort of stands on your shoulders, and you've just been an incredible trailblazer. But I got to ask, why did you pick DMVs as the place to do mandatory voter registration? You know what her answer was to me? It was a negotiation. I said to her, why didn't you pick hospitals? She said, we knew healthcare was an important place to register poor people to vote. And so did the opposition. It's been one continuous story in this country, trying to restrict and obstruct poor people, vulnerable people, people of color, from the ballot box. And how does healthcare fit in? Well, healthcare fits in because when you look at the demographic overlaps of who is not registered to vote in this country and who is most marginalized by our healthcare system, the Venn diagrams are nearly completely overlapping. Young people, poor people, people of color. And so we at VoteER believe that there's an opportunity there an opportunity to bring hard to reach potential voters into the electorate via trusted messengers, like healthcare providers, like physicians, like nurses, like social workers. We do that with these 3 different tools. Some of you have these already, which is great. Some of you, by the end of today, we'll have to think about, what role do you want to play? We use tools like the Healthy Democracy Kit. These are lanyards that basically have a visual prompt on them. And often patients will ask me, hey, doc, why does your lanyard say vote on it? I say, well, it says vote on it because if you're interested, I want you to take 30 seconds right now, and I want you to just make sure that you're registered to vote. That's it. I don't care who you vote for, but just make sure you're registered. Number 2, we create site-based materials like these posters, and we deploy them to hospitals, and then we create text messages like you see on the right, and we have health centers send them out. This is Dr. Steger. She's a physician, a pediatrician in Ohio. She does this as part of her social history. She says, do you smoke? Do you drink? Are you registered to vote? Simple like that. 24,000 healthcare providers like Dr. Steger have these Healthy Democracy Kits. 60% of them are physicians, 23% are medical students, 10% are nurses and PAs, and 7% are social workers. When you ask these healthcare workers, why are you getting involved in voting? Why are you making sure that patients can vote? The number one motivation, number one answer is to address social and racial inequities. And interestingly, we saw the biggest spike in these orders for Healthy Democracy Kits after George Floyd was murdered, after the protests started, after this period of racial reckoning in this country really got going. Who did we help? When we look at the data in terms of who, from an age and race standpoint, who are the people that were helped to vote, 50% were people of color and 40% were younger than the age of 29. So the population that we're helping skew more likely to be people of color, and then also they're more likely to be younger. So in summary, in terms of just the high level impacts, this is just sort of the numbers. We're going to talk about some other impacts in a second. About 46,000 people were helped to vote in 2020 by VoteER. That's either with voter registration or mail-in ballots. And that's because people like you, many of you, how many are there? 197 people. I think there are probably several dozen of you who are already doing this, who are already helping people vote. Thank you for that. You contributed to that number. 24,000 healthcare workers across the country got these kits, and about 700 sites use these posters, these discharge paperwork. And there are about 100 medical associations and national organizations like SNMA, like LMSA, like the American Medical Student Association, who are our partners. Hospital CEOs have also gotten on board. There are over 300 hospitals that promote voting through VoteER. These are just some of the emails that have been sent out throughout the country at some of these big tier 1 hospitals like Cincinnati, Mass General Hospital, the mHealth Network. This is University of Minnesota. And then obviously, as I mentioned, the organizational sponsorships and partnerships really sort of helping to blast this work to the next level in terms of making sure that healthcare providers can be defenders for our democracy and healers in a new way, not only healing people in the individual body, but healing the body politic. This is the most exciting thing I wanted to share with you today, and that's because it's people like you all, like many of you all are students. Guess what? Our student program was by far the most successful thing that we did over the course of the 2020 cycle and in the Georgia runoff, in the Senate runoff. The work that we did in the 2020 and the Senate runoff with students was called the Healthy Democracy Campaign. Okay? At each medical school, we got 2 medical students who were selected to be the captains. We taught them very, very, very basic community organizing principles. They put together a team. Most times they're just best friends, like they're 5 to 10 best friends, but some of them actually made the whole school into their team, which was really dope too. And we created kits that were specific to their medical school. So every time someone used a kit at their school, they got a point. These captains were able to hold each other accountable, the teams accountable, and the students were able to see how many points they got. And so there was a really cool gamification aspect. Each one of these students alone accounted for 40 people registered to vote. That's insane, absolutely insane, and so productive. Just the students alone across these 80 medical school teams that participated helped nearly 15,000 people either with voter registration or with mail-in ballots. That's like unheard of. So how can you get involved? There are 3 easy things that you can do right now, and then 3 things that I want you to think about, okay? Number 1, make sure you're registered to vote. You got a phone, scan that QR code. And if you don't want to scan the QR code, there's a URL right there. Take 60 seconds and make sure that you are registered to vote. Some people are going to say, no, I'm good, I just voted. Okay, have you gotten married recently? Because if you change your name, you got to register to vote again. Have you moved? You got to register to vote again. Did you just, go from one program to another? You got to register to vote again. If you went cross state, for example. So take 60 seconds. Number 2, get a kit to make sure other people can vote. There are thousands and thousands and thousands of people who are already doing this. They're just like you, and these kits are free. So take advantage of it. We really don't need to sell anything here. At the end of the day, this is all about just making sure that the idea of healthcare providers helping patients vote gets promoted. And then lastly, if you work in a clinic where you do rotations and the clinic director is super engaged and interested in voting and civic engagement, or if at your hospital you've got a champion or a faculty provider, or if you yourself are an authority figure at your hospital or your residency program, and you want to get posters or discharge paperwork, you can do that here through our site-based program, and there's a QR code right there. Lastly, in terms of the 3 things I want you to think about, there are a couple ways to get involved at sort of a higher level, and that is through these 3 different options. So number 1, at the end of the day, if you're not building power in people, then all you're doing is really sort of mobilizing these one-time efforts, and we understand that. And so, if we really want to make a difference, we've got to train you and build your capacity and your skills as community organizers. And so if you want to get involved as Healthy Democracy Campaign, which Maria was a captain for, and I think University of Michigan came in pretty high as well in terms of how well they did. If you want to get involved, then please go ahead and I'm putting a campaign link. You can learn about it, you can get involved, you can click there and you can sign up for it and be involved in the campaign. Number 2, you can learn the basic skills of community organizing through our Civic Health Fellowship. The Civic Health Fellowship is going to be starting in May. And it's going to be a great one, and we're going to have a lot of fun, and we're going to teach some people how to organize. And that's sort of a more in-depth, a more robust training experience. And then lastly, we have our Civic Health Conferences coming up in April. And if you hit that link that I just put in the chat, we'll make sure that you get signed up for it and you're ready for it. That's all I got. I have not been paying attention to the chat. I am so sorry, but I will definitely take a look and see if there's anything I can get anybody else.
Yeah, and Alister, we have about 2-3 minutes, but there are a couple questions. I don't know if you can see them on your end. I can read them out loud. The first one is, how do you believe this maps out to our disabled patients who are unregistered to vote? Then if they can register, deal with inaccessibility at polling places and voting locations?
It's a really good question. And the hard part about that is that it's really state dependent. For example, the voter registration process in general can be done for someone else if that person has valid ID. So there are some states where, if you have your social security number, you can use that number as the sort of proof of identification. You can sign up on a website via online voter registration. So that person doesn't have to actually go to any facility to get registered. Now, when it comes to actually voting, it's really, really challenging because you have to get someone to sort of be your designee, and that's very much state dependent. So my answer to that question would be make sure to check in with the state, with the Secretary of State offices, and just see, what are the options, and is there a possibility for someone to be sort of designated as being able to vote on behalf of someone else.
Next question here. It seemed like some of the institutional support, at least my community hospital, was tied more to the potential changes in health policies, such as the ACA, not to address racial inequities. How do we push to continue the support for promoting voting when health isn't always as clearly on the ballot? And then in parentheses, though, of course, it always is.
Well, I think what we have to do is, we as physicians, as medical students, as clinicians, we have to make it a point to draw the connection between health and voting. We have to be the ones to say, I'll tell you a story. I was taking care of a patient recently in the ER who was coming in for asthma. We talked about, her asthma. I was able to get her feeling much better. And as she was leaving, I said, by the way, we got a big race coming up here in Boston, the mayor's race. Are you registered? So why would I want to do that? Like, I'm good. I was like, okay. Well, you see how I'm writing you this prescription for albuterol, right? I'm writing you a prescription for albuterol because you have asthma, just like everybody else in your neighborhood. And everybody in your neighborhood has asthma because you have toxic chemicals that are being burned right down the street. You have a tire factory and a gypsum plant. And the air that you all breathe in that community is polluted. That's why you have asthma. And the patients that are living all across the way in the richer parts of town, they don't have to come in to see me for their albuterol. And guess what? Those companies needed a place to dump their chemicals. They needed a place to pollute the air. And they weren't going to do it in the downtown, nice, rich, wealthy, white suburb. Why? Because they knew they would catch hell. Because those people vote. So at the end of the day, we as physicians and healthcare providers have to make it clear why it's important, why voting and health are linked. And you're right, every year is an election year.
And so I think we're actually out of time, but I will consolidate some of these questions and get them up to Alister so he can answer them, and then we'll send it out to everybody who was here and was unable to attend as well. Dr. Alastair Martin, thank you. Thank you so much. This was a wonderful talk. I think we're going to take about a 1 to 2 minute break, and then we'll move on to the next workshop.